We are very excited today. We're going to have Dr. Alejandro V. Garcia joining us for this interview. And I'd like to just share some things before we get started. Um, and so the society, as you know, we have our mission, and we got to nurture, support, and advance Latino surgeons. And this month is particularly special for us. So we're going to be seeing a lot of that in the webpage of LSS and this Heritage Month. And we like to take just a quick moment to uh, remember Dr. Gregorio Sicard. He was a very active member of the Latino Surgical Society. He was someone who was pivotal in starting this society. So we're going to miss him. We acknowledge of his contributions, and the society wanted to take part of given the great surgeon person that he was. Um, this is our team. If you remember from prior sessions, thank you everyone that making this possible, and the founders, Dr. Romero, Arena, Dr. Fernandez Mora, Dr. Lopez, and Dr. Ortega. And this is what we have in our society currently, growing more members with every meeting, and we're very excited for what's coming. And we have our advisory board as well. And this is the programs that we are running, and we're very excited to very successful. We're going to continue that, and all of them are recorded. So if you want to look at them, we encourage you to do so. And as you know, we are part of a lot of partnerships, and being a part of the Latino Surgical Society gives you the advantage of connecting with other organizations and have other opportunities. So please look at the website and connect with us. And remember, we're going to be at the American College of Surgeons in Chicago for a networking luncheon, and we're going to have also a booth that you can join us and come talk to us, please. And, so we'll see you there as well. We're going to have a symposium in April as well next year. This is part of our communities and subgroups. If you have an interest, please join us. And these are the benefits. You can access to mentorship, development, community engagement, and we're very happy to support you. And remember, you want to self-nominate. There's an email on the website. You can go ahead and do that, and we'll be happy to find support for you so you can help us grow our society. And so these are all the ways you can connect with us. So please feel free to send us any message, and thank you for being here. So I'm gonna stop sharing what I had there. I hope that's done. So we're gonna start with this with our session, and as you know, we want to make sure that this is a good experience for you, and you get to ask some questions. So feel free to share in the chat any questions that you may have. And as you know, Dr. Garcia is joining us. He completed general surgery residency at Columbia University, a pediatric surgery fellowship at Johns Hopkins, and ECMO fellowship at New York-Presbyterian. He's part of the pediatric surgery team and faculty at the Johns Hopkins as vice chair for inclusive excellence. And he serves in many organizations, and he cares for patients with a lot of diseases, but mostly his interests are in IBD, diaphragmatic, chest wall deformities, and ECMO. So joining us is Stalin, one of our star members of the team, who's also from Ecuador. He's now PGY1. And for joining us. So let's quickly talk about you and a little bit about your background, where you come from. Why did you choose being a doctor, then a surgeon, and then a pediatric surgeon? So you choose the long, hard road, and how did that come about?
Yeah, thank you again for the invitation. I'm honored to be here. Um, yeah, it was a very long road, and certainly not something when I was very young thought that I would be where I am today. And certainly for the first probably 18 years of my life, if you asked me what a pediatric surgeon was, I couldn't tell you. Um, but I was born and raised in Yonkers, New York. My mother is from Ecuador, Princess in Ecuador, and my father was from Puerto Rico and Arecibo. They both met here, had me here, so I'm sort of first generation from being here at the mainland United States. And Um, Grew up very sort of low socioeconomic area in Yonkers, and fortunately, parents sort of pushing me in the right direction to keep focusing on education. Things worked out in terms of going to college, and I think I was. I'm sorry, am I frozen? Can you hear me?
We can hear you.
Okay, okay. Um, I I I, I never
A
really.
little, but I think I can hear you. We can hear you.
Okay. My interest in medicine, I always looked up to the medical profession as always something that I found interesting, translating from my parents, being involved in the healthcare arena. And then when I focused more on science and medicine, and then when I got to college, I picked the pre-med path, and that was what seemed fitting for me. And I remember um, when I was during winter break of my freshman year in college, I was able to shadow a surgeon down at in NYU at Mount Sinai. He was a cardiac surgeon, Dr. Garcia, and he um, showed me the operating room, showed me open heart surgery, and it really sort of put that in my mind that surgery was something that I could possibly achieve if I continue my passion in medicine. And one thing led to another, and I applied for uh, medicine, and then met incredible mentors along the way. Raja Flores was a thoracic surgeon at Sloan Kettering at the time, and he was a fantastic mentor, and really got me sort of interested in general surgery. So I applied there, and then during general surgery was where I rotated onto pediatric surgery, and um, sort of developed my interest in that. And I wanted to take care of children and families and all the complexities that come with taking care of children. And that's how I sort of landed on this profession.
That's actually great. I'm so happy to hear that you also have an Ecuadorian background. We have something in common now, something more in common.
A minute or so.
So I know you walk us through a little bit of the different stages that you have had in medicine. We also heard that you had an ECMO fellowship and then completed a pediatric cancer research in Morgan Stanley Children's Hospital in New York-Presbyterian. So
Mhm.
could you maybe walk us through some key moments that drew you specifically to these diverse of specialties? There were like maybe key mentors that you felt more represented. I mean, we're speaking to a time there was no LSS, so maybe it was harder for you to actually find mentors which maybe you can relate to. So how did you navigate that, or what were those things that
Um,
motivated you to go through all of this?
yeah, so certainly I feel like every step along the way, there was some mentor who happened to put me under their wing and kind of open up doors, or at least expose me to what was out there. When I was in medical school, like I mentioned, this Cuban thoracic surgeon who exposed me to general surgery, the operating room. He's doing these big surgeries, reconstructing the superior vena cava. And I was like mind blown. And I was like, wow, this is amazing. And he's like, hey, do you want to put in a chest tube? I'm like, what? I'm a second year medical student. He's like, oh, come on. So like those things really had a major impact on me. So when I made the decision to go into pediatric surgery as a second year resident, um, I realized that it's a very competitive path. Obviously, as we all know, in general surgery, pediatric surgery is amongst the most competitive. And I knew that most people take time off to, whether or not they got a PhD early on in their careers, or they took 2 years off to do research or some clinical project. I realized I needed to do something and take a gap in general surgery. So after my third year, I looked around at different opportunities around the country, and most children's centers will have some research opportunity where they have an established track record. You'll spend 2 years, either you get an MPH, or you'll do some basic science, or you'll do some clinical research. And I decided to stay at Columbia because they had a really good program on ECMO. I love the faculty there. There was some tumor angiogenesis research that they were doing. And to me, all of that was interesting. I love the field. I was like, great. I've studied tumor biology. I get to learn ECMO. I get to meet these pediatric surgeons and work more intimately with them. And hopefully, if I write enough papers and boost my CV, I can be competitive in this field. And that's what drew me to Columbia. But I know colleagues who went to other research programs around the country and had great experiences as well.
Yeah, pediatric surgery takes a lot of strategic planning, for those of the residents, the students who are in this conversation. I do believe that is, in my opinion, one of the most difficult subspecialties to get in because of how complex it is. Not only like the training, of course, is very complex, but it's just how to navigate their fellowships that open every other year. Their fellowships that are, mostly they never take people without 3 years of research or ECMO. Some people do critical care. So, being in three different institutions and navigating different things that you had. How do you feel that adapting to these environments help you navigate this very difficult environment? Because even when you're doing research, you're like, okay, should I take a degree? Should I just focus on my research? Should I just start taking maybe a third year of research? And because I've seen that happen with a lot of my friends. They're like, okay, I think this year the applicant pool is really strong, and I got to just keep one more year so I can get into the larger pool of institutions that are opening up. So. How do you adapt to that? So how do you find the strength and the mental capacity to adapt to that?
Yeah, I think all the different research opportunities that there are throughout the country at the different universities offer different things. I know at Boston Children's, they have very unique experiences from basic science to getting a critical care fellowship to doing some clinical work. So I leaned on the advice of other pediatric fellows who had already gone into the process and ask them for advice. Like, from your perspective, which places did people walk away with a good experience? Like, if you're very interested in critical care, then there are places like at Boston or Michigan that 2 years you're going to walk out with a critical care fellowship. You're going to do some research, and then that makes you very competitive. So I leaned on fellows to give me advice as to what they saw worked well. Residency program directors and the fellowship program directors were very good at saying, look, everyone that comes out from example, Michigan and does a critical care fellowship, that they have a 99% match rate. They take 2 years and they get in. So like those kind of things were very helpful to kind of help me figure out what path I wanted to take for my research time. But I know, yeah, some people take 3 years. They're like, well, let me add another year and get a PhD, or I didn't get enough science papers. Let me add another year. And I think you have to lean on your mentors, I think, to give you that advice.
Yeah, I think that's really key actually, to expose yourself to mentors, like get away from that comfort zone and try to put your interest out there and try to figure out who is the best person who can give advice to you. I mean, we already heard that you have some leadership positions in Johns Hopkins. You were co-chair of the pediatric surgical colorectal program, surgical director of the pediatric ECMO program, and also medical director of the pediatric burn program. So how do you think that being in these leadership positions have helped you to actually shape the path of other people who want to pursue maybe your path or maybe something different, but that you are able, given that position, to actually help them get to those places?
I think a lot of it comes with going to national meetings. And I think being part of the Latino Surgical Society, or for me, for ECMO, if I go to the ELSO conference, which is our national meeting, and I get to present my work or be part of a panel, and you get to not only meet other people who are interested in that same area of interest, but then you have residents, students who are also interested and come to those meetings to present their posters and their abstracts. And you get to meet a lot of people that way. And I think it's great to help sort of inspire people into things that I find interesting. So I think that's how I can use sort of these leadership roles to help other people in this pathway. Because I remember I had a medical student who was interested in Crohn's disease and anemia and came up to me and wanted to do research, and said, great, well, let's look at this database. Let's see what we can put together. Helped them through a project, published it, was able to go to a national meeting and present it. And through that whole process, not only did they learn some research, but that also got them excited about pediatric surgery. And they were like, wow, I didn't realize pediatric surgeons did this, did that. And I think that's how those leadership positions have helped sort of attract and build those mentorship relationships.
And I think we all have important mentors, and we're mentors sometimes now, and trying to change that. In your opinion, how do you recognize a good mentor? How do you know, okay, this person can be a good mentor to me, particularly in the pediatric surgery field? There's a lot of people who are interested, and you have to put a lot of time, and I think those connections need to be very strong. And so how do you, in your career and even now, how do you identify good mentors?
I think part is at your own institution. For example, if there are pediatric surgeons or whatever you decide to go into, talking to residents in your program who are ahead of you, who have already gone through the process, they can help identify like, oh yeah, you should go talk to so-and-so. They're excellent. They can get you involved in some textbook chapters or writing some papers, and they'll help you along the process. So I think internally, leaning on your senior residents, your chief residents, fellows that can help guide you in that, because they'll know, because they work with these individuals all the time. I think outside of your institution, going to national meetings, I think are very important, because when someone's on a panel, they talk about something that you find interesting, and you walk up to them at the end of that session and you say, hey, I really enjoyed, this is who I am. I really enjoyed what you had to say. I would love to talk more about you. Just that little 2-minute interaction, you can tell when someone's like very excited. Oh yeah, definitely. Yeah, we should definitely talk. And they reach out to you, and you can tell, versus other people that you come up to them and they're kind of like dismissive and they rush away. So I think you sort of have to put yourself out there a little bit to say, hey, this is who I am. This is what I'm interested in. And you'll develop that vibe. Like, yeah, this person's very interested in me. And I think most people are willing to, at least have a conversation with you about what they do, about what they're interested in. And hopefully that's how you can develop some mentorship relationship that way as well.
Yeah, no, definitely. That's a key part. And Stalin, you had another question there.
Yeah. So, well, thank you for sharing that. I think that's really useful advice. I never thought actually, I mean, I did research before actually matching in my residency, and I feel like getting out there in conference really help out to getting exposure to different people. I never thought like during residency, it's also important to like go and relate with other residents from other programs. Like still continuing those relationships are actually useful to may help you grow along the way. Um, so I know that a lot of your research that you have been doing focuses on different areas, especially like IBD and then congenital diaphragmatic hernias and other things, including ECMO. So what do you think sparked your interest in these specific areas? Do you think that that interest has changed according to the different mentors that you have had, or the opportunities that you had, or do you think like you were always loyal to the thing that you wanted to do and then you keep up to that? Or how do you think that dynamic worked along your path?
Yeah, I think the thing with pediatric surgery is that it's so broad, right? As you can tell from something you're talking about, doing IBD, doing burns, doing ECMO, doing diaphragmatic, thoracic stuff. It's very broad, and it's very easy to sort of get lost in doing all these different things. For me, ECMO was something that I was very interested in. I liked critical care. I liked being in the ICU. I love learning this complex system that takes care of patients. And I wanted to know more. I wanted to do research in it. And that was something that always interested me. I felt like this technology has the potential to save people, very complex. Not a lot of people understand it. And I wanted to be that person to understand it. So I think that's where my attraction to that went. For colorectal, for IBD stuff, I was about 4 or 5 years ago, we were just, again, doing just surgery, general surgery for pediatrics. And I saw a lot of colorectal specialists do robotic surgery. And, I remember talking to my group and I said, we should consider bringing robotics into pediatrics. And everyone's like, oh, come on, that's not for kids. That technology is for adults. There's no place in that. I can do it better laparoscopic, yada, yada, yada. And I said, no, I see how slick this is. I see that, there's good data that's being published in the adult world. I think that we take care of teenagers. And I said, I want to bring this technology here. And, so I pushed for it. I learned how to do it. I hadn't learned it in residency or fellowship. So that's something I had to learn as an old man, as an attending. But I learned it. And that's where my interest came, because I was trying to be innovative, try to push the envelope, leaning on my adult colorectal colleagues to come help mentor me, show me, hey, these are my tips and tricks. This is the ports that I use and whatnot. And now, at least for colorectal, the majority of what I do in pediatrics is robotic, and I've expanded that to other things. So it kind of just happened. I saw an opportunity. I saw surgeons talking about this, and I was like, why aren't pediatric surgeons doing this more? And I found an opportunity there.
Yeah, that's something that I think a lot of trainees don't realize until they're finishing, is that a lot of their practice may not look like the way your training was. A lot of the things you're, and especially how technology is moving, you may not even have in your residency, in your training, even in your fellowship. I think the way you were able to adapt that, it being able to analyze the technology, be able to be knowledgeable about it, bring it to your practice. That it's going to be part of your job, whether you like it. And so yeah, that's something it's happening a lot more than it used to happen in the past, right? Like, the jump for open to laparoscopy was a big jump. Laparoscopic data have the integration of different platforms, and that brings me to my question: technology, as you're able to take more and more from the medical standpoint, which is the ECMO, the ICU, and the surgical part, new techniques. How do you handle just also communicating the parents, like communicating this new technologies? How do you handle communicating difficult situations in this world that moves so fast, where people have more access to information? Of course, when you want to the best, and they may bring up things that you may do or may not do, right? As to robotics, and you're starting to do robotics. How do you handle that times with, particularly the families, and how this complex environment with information is?
I think part of the excitement in that, when you're looking into something new, is that it motivates me to stay on top of the literature. What's out there? When I go to national meetings, what other pediatric surgeons are working on robotic technology? How can I collaborate? How do I, keep on top of what's happening, so that, yes, when I go talk to my patient, there was always going to be a patient who was going to be my first robotic patient as an attending, and I had to be transparent with them, like, hey, there's this new way to do this surgery. It's being done a lot in adults. This is the first time we're doing it in children. I think it's very safe. I trained for this. And I think that X, Y, and Z are going to be the benefit to your child, and why I think we should do this. And being able to say that with confidence, with the data, like, this is what it is. And I think a lot of families have trust in and not only in their surgeon, but also when you're taking care of their child, even more so. That I think being able to have that confidence comes with knowing the data and being comfortable, and knowing that I spent my time on the simulator. I knew how to do this operation. I've had other surgeons watch me do it. So yeah, it's hard, but I think that's part of the exciting part about it. As other people may get scared, like, why do new things? I'm like, no, let's do new things. We can make this better, and I can work with my colleagues, work with industry. How can we make this tailored toward kids, so this could be better 10 years from now, when you guys are finishing your residency and getting into it? Maybe this will be the state of the art pediatric, where right now we're sort of just trying to get into it now. So
that is actually really important. I think you touched like really significant topics there, like trying to find that gap of knowledge, conducting your own research, trying to find that space to innovate, and then like validating yourself on the data and putting yourself out there to actually explore this new field. And that kind of brings me to my question of what qualities do you look for in a young surgeon who is gonna, like, looking ahead, you see this person is gonna like innovate, is gonna change the field. So what are those qualities that you look in a young surgeon, and what advice would you give to trainees that are interested in pediatric surgery specifically?
What qualities are you looking for? I mean, it's a good question. I can definitely say what stands out the most when I'm working with residents or medical students is, how motivated, how interested people are, how prepared they are for the cases. Being able to have an intelligent discussion. Sometimes I'm working with an intern or a second-year resident, and they know more about what we're doing than our chief residents or fellows sometimes, because you can tell they're very motivated. They understand this. They understand, the complexities of diaphragmatic hernia, and why we have to take a very careful approach to the discussion with the family and ECMO. So it's inspiring to see young residents or students who are excited and motivated. Like, hey, I don't care if it's a small case. I don't care if it's an umbilical hernia. This is a great case. I'm very excited to be here to learn, knowing that that's just the beginning, right? Like an umbilical hernia, yes, it's a small case, and you'll see some senior residents like blow it off, but like, there's always learning to be had. There's the relationship you build with that faculty member, and you're always learning how to get better. So I think that's one of the qualities that we look for. Just excited. Like, it's not just going to fall into your lap. You have to be excited. You want to be interested in it. And then, of course, just as the fellowship, it's just competitive, right? So it's going to be, there's always the list of things, right? The research, the publications, and textbook chapters, all the things that come with taking time off to do that stuff. And you can do some of it during your residency program. Not easy, right? Because it's busy, but you can sometimes do case reports. You can sometimes help faculty, finish a textbook chapter, whatnot. And I think it's worth doing that. yeah, I think just being able to jump on opportunities, and it doesn't. I've had people ask me before, well, if I do this research in vascular surgery, can I apply to pediatric surgery? Yes, it all applies. I think what is important at the end of the day is what's you're interested in pediatrics. Why are you interested in this field? What is it that you want to do in this field 10 years from now? What is it that you want to accomplish? When you start to be able to put those things into words, I think that's where you make a big impact in trying to get into the field. It's I've interviewed people for fellowship, and they have a list of 50 publications, and I ask them a simple question: what was your favorite paper? What and why did you like it? And some people are scratching their heads like, I wrote them. Like that doesn't tell me how interested you are in pediatric surgery. That just told me you wanted a checkbox and write all these papers. So I encourage people to really find what it is about this that's meaningful to them, and use that to drive the process, right? Your personal statement, your interactions with the faculty.
Yeah, that's those qualities. I think they're universal. I think I would just encourage anyone, even from applying to med school, and I have a lot of college students that want to shadow, want to see what they want to get themselves into, and maybe get a letter or maybe get an experience in the field. So I think that's valid for everything, and that brings me to my next question, Dr. Garcia. So when you look at the subset of Hispanic pediatric surgeons, it's a very, very, very small group, and I believe that's something that we're hoping to change. And I want to get your input about. I think it happens in every specialty, but I would say pediatric surgery is probably one of the most difficult ones to get in. How do you see the Latino young surgeons having a room in pediatric surgery? How the system may be difficult, and also how their exposure sometimes in other hospitals that may not have a pediatric surgeon, because as you and I know, pediatric surgeons, the one of the difficulties about pediatric surgery is that access to a pediatric surgeon is pretty hard, right? There's a lot of pediatric surgeons in urban areas or areas that are referral centers, not necessary areas where maybe a resident will be involved, and a good resident who went to a really good community program, and is an Hispanic resident. And how do you see that evolving over time? I know you probably faced your own challenges, being, like you said, you started from the bottom and worked really hard to get where you are. But how do you see the field for Hispanic Latino surgeons in general?
Yeah, I sort of I can understand that there's not a lot of Latinos in the field, in the profession. It makes me think of looking at the wall outside my office where they have all the fellows from 1965, when the first fellow trained here, till now, and I'm one of 3 Latino surgeons in this wall of 60 of surgeons, and that says a lot, right? And I think things are getting better, and there's societies like this, which is what allows individuals to, hey, let me reach out to a pediatric surgeon, a vascular surgeon that is part of the Latino Surgical Society, that that I can just talk to and just get their experience, and then maybe that turns into a lifelong mentorship, or maybe that turns into just someone that you can touch base with once a year to just get advice on. So I do think you have to be sort of open to looking outside of your institution, because, like we said, there's rural and not everyone has access to a children's center at that academic place wherever they train. I think just trying to keep an open mind, just try to find mentorship in it, and your best mentor may not be in the field that you go into. I remember some of my mentors, even to this day, are not necessarily in pediatric surgery. They're vascular surgeons that I still talk to all the time to get advice, and sometimes it's just life advice, right? Like, just, you had a tough case and the case didn't go well, and it's nice to sometimes have mentors that are not even necessarily in your field but can understand what you go through, and may not even be surgeons. And so I think it's important to have a broad mindset when you look for mentorship.
Thank you. Yeah, that's a very important thing, and I do believe that it starts with believing, right? Like making sure that if other people could do it, you can do it, and reaching out to the people who accomplish what you accomplish. It's something really key in this field.
Yeah, I think I want to get back to that part of handling emotional intense cases and maybe having that opportunity to share with a mentor. Like pediatric surgery can be so emotionally intense. I feel like you have to take care of both the children and their parents as well. So how
Mhm.
do you maintain resilience and continue finding meaning in your work despite the challenges? What has been those biggest, like the biggest challenge that you have had, and how have you been able to like work through that?
It was interesting. I remember reading a paper about the whole work life balance and people's job satisfaction and how surgeons have a relatively low job satisfaction rate. But those who had mentorship, there was sort of a relationship. The more mentorship you had, the better job satisfaction you have. And I think a lot of it has to do with what you're alluding to. Not every day is going to be great. Not every day is going to be an umbilical hernia and an appy, and then I get to go home and like, yeah, you did good cases. Um, sometimes I do a case where I do a colectomy for Crohn's disease and it leaks and the patient's in the hospital for 4 weeks and they're in pain, they're miserable, getting drains, and I have to go round on that patient every day and it's hard. I'm like, I have to drag myself, like, I got to go up there again and talk to this family and I'm just gonna have to hear it, and that weighs on you. And I think having those mentors, the close friends at work, and again, it doesn't have to be within your field, right? It could be, there are close friends of mine who were in general surgery with me who are now in practicing in other fields in colorectal and vascular surgery, who I still could confide in them, like, man, this happened. It's like, it's okay, for that one kid that may not have had the optimal outcome. There's 50 other kids that you helped and are back to school and are happy and are sending you photos for Christmas, and the families, like, sending you cookies because they're so happy. So it's easy to dwell on that hard one. And sort of what I've learned from my mentors is always, okay, you got to accept it, right? Like, this complication happened. Grieve, be transparent with the family, be honest. And then the next day it's, okay, how do I grow from this? How do I prevent this from happening again? How can I become a better surgeon and learn from it? And sometimes you talking with someone helps you do that. And then my family, I have two small children. My wife understands sort of what I go through, and I'm able to separate, work from life, right? And I'm able to come home and okay, like, that was what happened today and that was terrible, and I can talk about it with my wife and she can help me with that. But then now it's like, now it's time for my kids, and I have to separate that from my life and what's important to me and my values. And I think that's what sort of gives me the balance, and how I can go back the next day fresh and like, okay, now how do I tackle this problem? How do I make it better? Because it's not all going to be, you know roses and petals. Like, there's going to be hard days, and I think you develop the resilience over time, but you have to lean on people. You can't just internalize that and just like let it fester. You gotta, because other people go through it too. And so I also try to be that for my partners too. When I see my partners struggling, like, hey man, let's talk about it. Let's go get a cup of coffee. What happened? And people open up. So you try to be there for other people too, because it is a hard field. It's high stakes sometimes.
It is actually
Yeah.
really important. I think like there are like some coping mechanisms that one can develop throughout time that I really hope to develop at some point. And I remember being part of these leadership classes and coaching, and one important part of being a coach was just listening. I mean, just walking the person through the things that they need to share to actually do their own reflections. So, like while you're speaking to someone, you don't actually need that advice because there's not much that can be done, but you actually need to work through that, and having a coach just to listen and help you guide you through that path, I think is actually really valuable.
Yeah, thank you. I think that's something very important, and any provider can be the second victim of a complication, and you don't want that. You want to be at your best, and taking care of yourself will allow you to take care of your patients. And there's a moment to grieve, and there's a moment to make sure that you're can separate in a healthy way from that complication and make it make it the best for the next patient. So thank you for sharing that. I think that's really wise, and that brings me to the next question. Also, when you're looking at different fields, and we're going to go to the questions of the panel later, but when you look at a field so competitive, general surgery, then pediatric surgery, and how education has changed in the past probably 10 years since you graduated, since you started, getting your life set up as a practicing pediatric surgeon. what changes do you expect to see from your specialty for the better? Not only like scientific and technicals, but culturally speaking, and regarding minorities or Hispanics, Latino, or being a more open to serve areas, or what do you expect in your field in the next 10 years when you're kind of mid to late career maybe?
Yeah. I would say, I mean, a lot has changed over the last year with the political environment. I'd say up until the last year, I think there was a big push to an awareness of what was happening with the immigrant population, with the diversity issues, with social determinants of health, and the issues that patients face, and why there's this recidivism that patients keep coming back with the same problem. Trauma patients that send home come back, and you realize that it's their life circumstances that have caused them to get into the cycle. So I think that there's a lot more onus being put on the barriers to healthcare and how that influences outcomes, even for surgery, right? Why is patients with appendicitis come in late? Maybe they don't have resources. There's no education in the community. So I think that there's been a lot more awareness in that. Unfortunately, as we all know, in the last year, things have changed with this administration. And now I feel like a lot of that is being hampered. And I do worry in the short term that some of these things are sort of being swept under the rug a little bit to keep universities happy and compliant with federal regulations. And I have LMSA at my institution, and they're getting pushed down a lot with a lot of their wording, their verbiage. You're inviting this person, you got to add all this, all the diversity stuff has to go away, all this inclusivity stuff has to go away, and I have to keep reminding people, you got to stay in the fight. This is going to be a short-term thing, and we got to advocate for the patients who need it, the families who need it. So I think we built a lot of momentum. We hit a little bit of a roadblock, but as long as there are people that are still passionate about this and are still focused on the goal, which is to help patients, I think we're going to get through this and it's going to be fine. But this is a hard part right now. But I do think the field is getting more open in general. Pediatric surgery, I think before the old white males going into pediatric surgery has changed. And I think it's on us to keep that momentum and keep advocating and keep pushing forward.
Yeah, that's the only way.
Thank you for sharing that. We have a couple of questions from the panel, so maybe we can go one by one. So the first one is from Isabel. In countries where pediatric surgery is not a large specialty and mentorship is limited, what strategies do you recommend for an IMG to find guidance?
I mean, a lot of places, again, I don't know now with the current healthcare administration, the presidency and whatnot, doing visiting electives, coming to spend, 3 months at a children's center doing pediatric surgery rotations. I mean, we have, for example, at Hopkins, the ability for international medical graduates to come and spend time, whether or not it's several weeks or several months, so that they can get that exposure, get that mentorship, maybe do some clinical projects while they're here and get that exposure. Sometimes that means taking time off to be able to do that and do a research time. But I think that there are opportunities, and I think what I would recommend for someone interested in pediatric surgery to look at the APSA website, which is the American Pediatric Surgical Association, and look for opportunities, visiting electives, things like that, which are there, and connecting with the people and applying and doing it. So I think there are resources available, and I would start there.
Thank you. That's great advice. I think for also every specialty, and your countries of origin, you may find some things that you don't have, and it's just about the power of looking for them and looking for these resources. We're going to move on for another question from the panel, but I have a question that I want to ask you, and it's about your ties to Latin America, being a Latino surgeon, and how you keep those, how you keep that in your family, and what has that how would you learn about those ties with Latin America that has helped you in your career, about your personality, of course, your ability to maybe to communicate or relate to Hispanic patients, but what else have you found really satisfying and with your ties with Latin America through your parents, being a first generation?
I think being able to relate to some families. Baltimore has a fairly high Central American population. And I see that those families who come to my clinic, and the fact that I'm able to really relate, connect, and understand some of the experiences that they're going through because of experiences that I had growing up or my family. Being able to make that connection, I think, is huge, and impacts me in a way that I don't necessarily feel with a lot of other interactions that I have. Like, I feel like I'm having even more of an impact, and I can take a child who's coming in with appendicitis, and I see that their child is suffering with obesity, and I can relate to the family and say, look, yes, we dealt with the appendix, but how can I help use my shared experiences and my cultural background to be able to make a meaningful impact to help this child? And I feel like that's where I can take my level of medical care to the next level. I have done some international work. I have gone to Ecuador, to Riobamba to do some work with some of the plastic surgeons here. There's trips planned to Guatemala. So I think when I do those trips, even more so, I feel more connected, more value in what I'm doing to the relationships that I had with my families, and sort of seeing where they came from, what they grew up with, and now being able to have an impact, come around full circle. Now I can go to those communities and try to help. I mean, that's some of the most fulfilling thing that I'm able to do by far.
Yeah,
I think I can relate a little.
fantastic.
I am just beginning, and when I find a patient who speaks Spanish, such a different experience. They become so happy and they tell you their whole story, which normally they wouldn't, and you find out specific things that they wouldn't have been able to share with a different physician, right? Which is really fulfilling. So we have a different question from Devon. How do you envision pediatric surgery changing in the next 20 to 10 to 20 years? What qualities does a pediatric surgeon need to be great that differs from other surgical specialties?
How do I feel like the field is going to change? We kind of alluded to some of the things before. I mean, I think, the technology is going to change, the research is going to change. Some things like appendicitis becomes non-operative, right? And that's something that people are advocating for, where 10 years ago was unheard of. So I think that there's some just natural shifts that are going to happen in the world of surgery that's going to keep us on our toes. I think what differentiates pediatric surgery from other surgical specialties is obviously we're working with kids and families. And I think that that's sort of inherent, and you got to be, understand that when I go talk to a patient and a family for something as simple as an umbilical hernia, for me, yeah, it's just an umbilical hernia. But for that family, for that mom, for that dad, this is a huge thing. This is a big deal. Their 4-year-old is going under general anesthesia. They're going to have surgery. They're going to be they're not going to be able to see them or hold them during that time. That's very scary for them. So I think that you have to, and that may not necessarily always apply in the adult surgical world, but you have to have that sense of compassion and empathy for what families are going through. And now that I have kids, it sort of took it to the next level for me, because now I understand. But even before, I think there's something that comes with this field of being very sort of humble and understanding, these are kids, these are parents, and something as small as a little bump that you're removing is a big deal, and you have to take it seriously. So I think that that's something that, if you were to ask me what separates a pediatric surgeon from everyone else, it's children and families, and you have to be a little bit appreciative of that dynamic.
When you talk about that, I think that's something that people who do not understand a lot of what happens in the pediatric surgery world is like you get to be a physician for a whole family. You are not just the physician for the kid, and that's something that is very, very important. And you alluded to some changes that may happen, and one of them is just learning how to be that, and how to be a more compassionate and understanding of that situation, especially with changing dynamics and social status, etc. And I have a good question that it's a very interesting question about the future of pediatric surgery. Do you think that, as you know, in Latin America, pediatric surgery, this comes from Mike, and he said that, most countries in Latin America, pediatric surgery is like a standalone specialty. Even in some places, you have to be a pediatrician, then you do solely pediatric surgery. You don't have to do training in general surgery. Do you and also some IMGs are practicing with medical licenses, institutional licenses, due to the sometimes lack of pediatric surgeons. Do you think that's something that should be explored in the future, kind of making a standalone pediatric surgery as a pathway, like, thoracic surgery was in the past just one subspecialty, plastic surgery, vascular surgery. Do you see that happening in pediatric surgery?
Uh,
Think?
I mean, I think that there's probably a shift to moving in that direction now more than if you were to ask me 10 years ago, because I think that in general, a lot of general surgery specialties are looking into early specialization. Can we cut down general surgery to 4 years and then spend 3 years in pediatric surgery instead of two? I think unlike other subspecialties like vascular, thoracic, things like that, I feel like pediatric surgery does benefit from general surgery training. I think a lot of what I do is still general surgery. Every once in a while, I have to take out an adrenal gland, or I have to, like I said, the colon work, or take out a thyroid. I mean, so the experiences that I had on endocrine surgery, on vascular, I think are invaluable, and I still use it today. So I do think that general surgery to pediatric surgery makes sense. Will that ratio change from currently 5:2 to something different? I do think that's going to happen. I think that's just general shift in general surgery, and for people to spend more time in their specialty unless I'm in general. So I think it's going to happen. I don't know when, but switching to completely pediatric surgery being its own training, I don't know. I think we're probably a long ways away from that, I think.
Thank you. Darling, you have more questions, I think?
We have two more. So one of them is, how does research in pediatric surgery differ from adult surgery, especially considering ethical challenges?
Certainly for clinical research, there's a lot more challenges, right? Because families have to be able to consent. A parent has to be able to give consent for their child to do the procedure. There's something about, a child being able to give, I'm blanking on the word, but verbal consent, that they agree to it, that they understand, but ultimately the person signing the consent for the research study is going to be the parents. So I think that there's an extra layer of complexity when it comes to clinical trials and clinical projects that you don't see as much on the adult surgery side. But other types of research that are non sort of clinical trials or prospective studies, I think, it's the same as in the adult world, right? Like doing retrospective studies, case controls, and that sort of thing. I think that's the same. But yes, when you're doing clinical trials, I think it's a little bit more complicated.
That's for sure.
Excellent. Another question is, this kind of ties into this again, Mike, ties into the integration of pediatric surgery with general surgery. Do you think there's a role to creating a MIS pediatric fellowship that will be something to, something that you think will happen, or you think the training that fellows get, it's enough to go ahead in the practice, and you don't want to steal that volume for the fellows to do a super fellowship in MIS surgery in pediatrics?
Yeah, I think the field is adapting, and it's going to become more MIS over time. And I think right now we're sort of right at the pinnacle of things shifting, because, as I said, I learned a robot. I'm one of 8 partners, and I'm one of 2 that does robotics. And I've done about 100 cases now with the robot. But now I have residents who come into fellowship who have done more than I have. So how do I train a fellow in a technology that they're better at than I am? So we're sort of at that issue, right? We're at a clash. So working through that, but I think as a whole, the field is going to move in that direction, and I think pediatric surgeons across the country, as they get more comfortable with technology, it's just going to become that. And I think, we're going to do less and less open surgery, and there's still going to be some in my group who are, no matter what, I'm going to do an open inguinal hernia, and no one's going to change me till the day that I die. And that's fine. And that's good for the fellows, and that's good for the trainees to learn how to do that. But I do think overall, as people get excited and see, and like I present my data at a conference, hey, my first 100 cases of robotics, and people are like, man, you did a pancreas on a 12-year-old with the robot? Like, tell me more. And people start incorporating that and adopting it. And I think 10 years from now, it's going to be the standard. I think that most pediatric surgery places are going to be doing MIS, and the open is going to be far, far less.
And I believe with that, like all the equipments and the platforms are made for adults. So as the adoption increases in pediatric surgery, they maybe the industry may adapt to that and see, okay, there's an opportunity to create specific ports, but ports for children or specific platforms, and the single port may be more useful for children than it is from adults in certain circumstances. If certain things that are really moving along, that's great. I think we have another question from Patricia Santos. You wanna read it, Stalin?
Sure. So I think that's the last one. So what
Yeah.
advice can you give to an IMG applying this match cycle to surgical specialties?
Applying this cycle, so happening this soon, within the next couple of months.
Yeah,
the next
probably,
5 days. Yes.
Yeah, I think as I mentioned before, when I have someone who's applying in a program and they have 50 publications and I ask them what they're most proud of and they have trouble, I think be very confident, be very proud in what you've done and what you bring to the table. Why are you interested in this particular field? And be able to really explain that with enthusiasm, with excitement, for what you hope your experience brings to the field and what you hope to change in the field, what you envision. Like, what is it that you saw in your training that had such an impact on you that it made you want to do this? And I want to do this. I want to help those families, and I want to be able to do research in this in the future. And I think you have to really focus on your strengths and really be enthusiastic and really be motivated to share what you want to share. The worst thing is when I see someone who I know is good, who has talent, but they're very quiet in an interview. They're very, shy, and you're like, this is your chance. You got 10 minutes. You got to really, like, why do you want to do this? Like, you can't, like, it's not on us to kind of pull it out of you. You have to be really excited. So I would say, if you're in the interview cycle and this is the process, practice with surgeons, practice with people at your local institution to be able to get that experience, that comfort, to share that excitement, because the questions are fairly standard and they're going to become even more standard given the current administration. We're already seeing the interview process. There's a standardized questions. We're not even allowed to ask people about certain things anymore. So I think that helps the applicant, because now you can rehearse and practice and be prepared for pretty common standard questions. So I would say practice the interview process.
Thank you, Dr. Garcia. I'm going to end with this question, and thank you for your time, your wisdom. Congratulations on your achievements. You're making a big difference. You're a big example, and you're an inspiration to many on this panel, and also in the Latino society, but surgeons and med students. So I have one last question for you. If you had to give yourself an advice when you're younger, what would it be and why? What advice would you give yourself, your young self?
How young? I feel like I'm pretty old now.
What stage you think you needed? No, I don't think you are, but any stage that you think, like, I would have used this advice that I know now that I didn't know then.
I mean, I think I would have wished earlier on, if I could tell myself back in college, to focus on that mentor relationship, identify those mentors. I know that's a theme that's kept coming up over this hour, and I think that sometimes when you get discouraged and you're sort of deciding, like, oh, pre-med's not working out for me, or I don't know if I'm going to go to ped surgery, or I'm not sure if I'm going to persevere in this. If you have those mentors, those people that you can lean on early on, and you'll find people. Like, I have some residents now that are not even in programs here. Like, I have someone in Nashville who's in general surgery now, and he sends me pictures of, he just got married, sends me pictures, or he has a tough case, he's calling me. I'm like, I'm not even at his institution, but we developed that relationship that I'm like, on the drive home, hey, tell me how things are going. And I think if I had to give my younger self advice, it'd be like, find those relationships, find those things, because they keep you focused on the goal. You don't, you all get beat down. There's hurdles we have to jump over, but the mentor is going to keep you on the goal, like reset you. Okay, things are bad right now, but there's still a light at the end of this. So that would be my advice. And I think the society is perfect for that.
Thank you very much. And I know for participating and being part of the society. And I'd like to thank everyone for your time. On behalf of the Latino Surgical Society, thank you for being part of this. You can listen to this recording after, and making sure that we could, together, I think we can make a big difference. Thank you, everyone, and have a good night.
Thank you very much. Bye.